This is Bruce Victor, who I have never met before, but he is indeed in the book, and he is the recipient of Neurofeedback and also the Neurofield,
Yeah.
and is a patient of Dr. Victor McGregor. And who was that in your lap, Victor?
Teeny. I bought Teeny as a companion for my daughter, who's an only child. But my connection with Bruce is somewhat related to, through the animal kingdom, because one of the first things I learned about Bruce when I first met him was that his best friend was a black lab.
Yeah.
So we immediately connected, and I think I took off also with the theory that I had in my mind for some time after reading Daniel Stern, I think it was, who wrote about attachment theory. And attachment theory is getting more press now, and neuroscience is having very important neurobiological explanations for what we really mean by a deep attachment. So I think intuitively, when I first met Bruce, I had some sense, or qualitative sense, of an attachment that Bruce inherently has that we haven't spoken that much about, but I think that's what made me more alert to connecting with you when I first met you. And by the way, we met at a therapist in New York City called Stan Myers, who's a leader in group psychotherapy, and occasionally he throws parties. And he's at the age where he can afford to do that. And I think we met first there.
Yeah, I think so.
At a party at Stan's place.
Yeah.
And Bruce, I understand you had years of conventional therapy before you started neurofeedback. Is that right?
Yeah, I've had a lifelong depression
Uh-huh.
that's been severe, and other problems, and I've been medicated and treated my entire life
Wow.
for the depression.
Is that right?
Yeah.
Yeah. Medicating, you say, yeah.
Yeah, I've been medicated, yes.
Mm-hmm.
And the most recent one, which I personally stopped, well, recent two that I stopped, was 16 and a half years of a Mayo inhibitor, Parnate, and about 5.5 years with Abilify. And my memory was deteriorating, and I reached a point where I was just pretty much just waiting to die.
Oh.
Just sat and wait. That's what I did. And I tried psychiatrists and neurologists to work with me to set up a protocol to get off of the Parnate, which no one was willing to do because there's such a high incidence of suicide when people come off of that.
Parnate?
Yeah.
What is Parnate? That's not
It's a Mayo inhibitor, monoamine oxidase inhibitor. Yeah.
Monoamine?
I was running at 20% over maximum dose for the last 10 years I was on it. Still depressed.
Yeah, and historically the MOAs were very common back in the days before SSRIs, so they were the mainstay effective antipsychotic that fell out of favor because of the suicidal risk. If you didn't follow the diet, you'd get a stroke. You would stroke out from high blood pressure if you took any food.
Aged cheeses, port wine, caffeine chocolate, spinach. I mean, there were so many things that reacted with, that contained certain amines that the chemical reaction pushed your blood pressure over 200. People had strokes.
Wow. And the suicide rates are very high with coming off Parnate?
Yeah. Well, not all Mayo inhibitors. All Mayo inhibitors. So I ended up drawing up my own protocol. I followed that. And took myself off. It took me just over 10 weeks to come off of it.
And you were headed for being a doctor at one point yourself.
Yeah. I went through 3 years of med school in Europe.
Well, in Europe?
Yeah, in Belgium, yeah.
Oh.
And
So what happened when you began doing the neurofeedback? When did you realize it was going to help?
Well, I noticed changes immediately. The first thing I noticed was that my peripheral vision restored, because I would be walking around almost like in a tunnel, and then I'd suddenly become, within the first 5 to 10 seconds, I'd become aware of things at the edge of the periphery of my vision. And that happened every single time I got a treatment.
Lens or neurofield?
Neurofield.
Neurofield.
Neurofield?
Yeah.
Also, the depression rose. That took a while. And in June of 2000, I suffered a severe memory incident from stress. And medication, stress, and metabolic issues wiped out my memory. I couldn't learn anything new, and I couldn't recall names of anything. And I tend to, I design things, equipment, molecules, things like that, and I normally think in images and name the things as I'm thinking them through, and I just watch the image of what I want it to do or be or have or whatever.
As a chemist?
Well, as a chemist, as a chemical engineer, as an engineer, as a designer, I also draw and paint too. But anyway, what happened was I couldn't find the name, so I couldn't design in the same way. So I ended up recognizing what I wanted to do, then just having the image in my head and then naming it at the end. So that I ended up taking half as much time to come up with a solution than the old way of naming it step by step, you know?
Yeah.
So that was my adjustment to that. But I've recovered about 85 or 90% of my memory.
Wow.
In a year of these treatments.
Under the neurofeedback and neurofield.
Yeah.
Yeah, but basically just Neurofield. We've just stuck to the Neurofield in all its variations.
It's been great. It's been absolutely great, and although stimulation of the lobes of the brain do bring about certain changes, I was always afraid, like with medications, if you didn't do it for a while, you would slide back. I had a few incidents where there was sliding back, but I think it was me, not the treatment, to tell you the truth. Because some things now stay. They just stay.
And Victor, maybe you'd share just a little bit. You're using both lens and neurofield in almost every treatment, are you?
No, just the Neurofield and many different protocols. You know, we started off with Nick's protocols. Then I tried Jackie's because Jackie DeFries had some interesting protocols, but we didn't have as good response with Jackie. So then we went back to Nick's. Then we added Mike Beasley's.
And Beasley, yeah.
And you were running long sessions too, right? I mean, you were running the neurofield.
Yeah,
for
you know,
quite a
we
while.
started when Nick just had the cap. Then we got the helmet. Then we got the
Paddles.
coils.
Then we got the larger coils.
Yeah, then we got the larger coils. So that's
We
where
got
we're
the
on.
chamber.
Yeah.
Wow.
So
So you're really exhausting the power of the neurofield. And but do you come every week for treatments?
he did, but occasionally, like Bruce said, he's an engineer. He learned the technology fairly quickly, and he was able to do some treatments on his own at home. So a few weeks, especially when I didn't see him regularly every week, then Bruce just did treatments at home.
So you have the equipment yourself now?
No, he
No,
just
I
used
use-
one of
You
my
use it.
machines.
Oh, I
yeah.
see. Uh-huh.
Yeah. And either I drive up to
Yeah, we meet
Victor's house or in the town
in Newburgh because
or meet in Manhattan or something, yeah. So we arrange.
These treatments actually work in Newburgh, huh?
So, yeah, we do it in the car, sitting watching the Hudson River.
I mean, to get back to it, I mean, other changes I've noticed is I've been painfully shy my whole life. And if there are more 5 or 6 people, more than 5 or 6 people in a room, I tend not to speak to anyone. And I'm uncomfortable in the room. That's gone for the first time in my life. Absolutely gone.
Quod erat demonstrator. You're here in front of
Right now, yes.
Yeah.
And I'm fine, but that completely gone. You know, and
Wow.
I mean, there's so many things that I've noticed. It's not something I would describe. And I mentioned to you before, I've been to a lot of neurologists, and I've been through neurologists, and I went for almost 4 years to a cognitive therapy group at Cornell, and one of the neurologist in charge of that reports to my cousin, who's a neuroscientist. That didn't help, and we tried all the different medications.
Cognitive behavioral therapy didn't do so much.
No, cognitive behavioral therapy did help with other issues in tracing back the start of the thoughts that triggered the depression at that moment, but that didn't change the overall aspect. It just helped me at crash sites, you know, I mean, pull myself back a little bit. But
Yeah.
so it's been quite a thing. I mean, like I've mentioned frequently, I mean, I have 90% of my memory back, which is good because I work as a scientist in different aspects. And I have patents in optics and in cosmetic chemistry and things like that, but that doesn't change the fact that it was gone. And now I have a reasonable memory. I mean, I used to remember everything, absolutely everything, and I thought I was obnoxious, you know, but now I have a useful memory, and although it's not pleasant to realize I don't remember everything, what I do remember is fairly good, so.
That is great. I was just so struck as I read your story over, never having met you, of your just obvious intelligence and
Thanks.
how you were able to describe the process that you went through so clearly. So,
For me, I wanted to be very aware, because the more information that I gave to Victor and then back to you, the better we could adjust the protocols or the selection. So I would benefit from it and you would benefit from it. So I'm that self-aware. I mean, I've had migraines my whole life too, so you become on a certain plane of constantly monitoring. If you can take certain medication before it hits, you can avoid it a lot of the time. But you have to be self-aware enough to see, all right, this is starting here, you know, or something like that.
Yeah.
So I constantly monitor these things, especially for the value of the treatment, and it helped. I think it helped.
thank you so much for
Sure,
coming in.
sure.
A real pleasure to meet you.
For me too.
And, yeah.
For me too.
Thanks again. Oh, so cool.
Yeah, I'm sure if Steve had more time, Bruce could talk about his history and coming from this intellectual family
Terrible.
where everybody was so intelligent they forgot about the emotional being in the room, and, and the put downs from those early years that just get ingrained in the bone.
Do you want to say anything about that, Bruce, or
There's no need, but
if it feels too personal, don't. But if you feel like saying it,
well, my last name is on this, so I mean, obviously, it's easy to trace.
I
The
see.
6 cousins who were MD PhDs and problems in themselves, you know. So,
Okay.
so there's no need for that.
Okay. Cool. Well,
too
thank you very
personal.
much. Yeah.
Yeah,
And
sure.
The amazing thing about neurofeedback is we don't need to delve into everybody's Oedipal and toilet training histories and the dysfunctional family they came from. We just get better. And people, when they get better, they have more insight into what's going on in their lives. And
But in truth, I've had so much therapy in my life. I mean, 40 analysis, the purpose of that is to survive the analysis. You know, I mean, so like with treatment for cancer, you have to survive the treatment, you know?
yeah.
And so what this does, it starts with where you are now and moves forward. It doesn't have to have a why or a when. Just know what you have at the present and what you're looking forward to generating improvement in, you know?
Yeah, and getting proprioceptively aware
Yes.
is really important, and you're obviously demonstrating that
Yeah.
for us. Yeah.
Yeah,
Cool.
yeah. That was I knew when I first put the cap on Bruce, and he had this experience of his peripheral vision expanding to what I think Les Femi talks about, this open awareness, right?
Yeah.
I don't know if
Open
it's the
focus,
same thing. Yeah. But Bruce has that. As soon as he puts the cap on, there's
Within
a
10 seconds of the treatment,
shift.
it's
So that's
Wow.
how I knew he was a good receptor for the neurofield, and we didn't have to change it very much. I think if we go in the future, Bruce, we can look more at the posterior cingulate, which is a point in, you know, once
Right.
I learn more about Loretta, we can start using some Loretta to focus
Yeah,
on.
we've got that. We're just learning about it. So.
well, I'm available.
Hey, cool, man. Thanks again.
Sure.
All right. Appreciate it.
Nice meeting you.